Hello. Uh, just want to give an update on what's going on. And my I got a CT angiogram head and neck, and that showed my right internal jugular vein had stenosis, like 90% or greater, and the left had stenosis 80% or greater. So that's like narrowing. Um, and that's like the between the styloid process and the C1 transverse process. The transverse process is just the side of the C1 that sticks out a little bit, and everyone's internal jugular vein is pretty much touching that by default. So if you have a neck injury and your C1 rotates at all, like if it rotates 4 degrees, well, it's going to be pushing, and it rotates like forward on the right, then it's going to be pushing on your right internal jugular vein. Now, whether or not that causes an issue, then you can have some compression. And most people, it looks like they have some narrowing up on the hi ducks. Anyway, there's some narrowing on this. Oops, get over here. Of the internal jugular vein up in the C1 area, just because it's like a smaller opening. It's not like a hole. Like the artery goes through a hole in your actual vertebrae, but the internal jugular vein does not go through a hole. It just runs along the inside of your neck up in here and goes up towards your mouth and then back into your skull. But it goes in front of the C1. And anyways, mine's if you have damage to your alar and transverse ligaments, like if you have damage on the right, I believe that's what causes it to rotate more forward to the right. If you see the structure of like how the alar is, you could see how if that was loose on the right side, then that would allow the C1 to move more forward and rotate that way on the right. And I seem to have overhang on my right, like on the original digital motion x-ray I got, which indicates alar damage on the right. But also, if you have damage on both left and right sides, meaning like stretching or tearing, it doesn't have to be like torn in half or anything, but then it can move forward. So like the whole C1 can move forward somewhat. And so I've got, I don't know, like 2.5 millimeters of space between the C1 and the styloid process, transverse process and the styloid process on the right. And you're supposed to have about, I don't know, 8 or 9 millimeters of space if you want like the best flow. Some people might have 7 and be fine, or 6 and they're fine. It's you could have some compression and be okay. Like some stenosis. I wouldn't even say compression. You could just say some narrowing of the vein, but it's not really affecting blood flow. But I had the CT angiogram and they showed that very severe stenosis. And so I'm trying to figure out what to do about that, because that appears to be what is causing the tinnitus. So there's that. But how to fix it, like, that's difficult because there's so few doctors that even know how to handle this kind of thing. Like, I mean, if I talk to a neurosurgeon about it, they've probably heard about it and maybe done a few operations like regarding it in their whole career. So it's not like and it's weird though, it's not like a totally rare thing. It's like there's probably tens of thousands of people that have tinnitus from what I have, like in the United States, and they just have to live with it because they don't know what to do. Like, for me, I kind of figured it out, but I don't know. I'm also unusual in that, like, when I exercise, when I increase my blood flow, the tinnitus goes away, or at least gets quieter. If I do a lot of exercise, it can go away entirely for a time, but that's pretty intense. It's not like I can just exercise like that, like intensely, like all day long. But it gives me an excuse, I guess. Anyway, but a lot of people, they will increase their heart rate, and when they have tinnitus because of vascular problems, and the tinnitus will get worse. The only people I've seen with problems in their brain, like a vein in their head, like above the C1 level, that was they're like me, but the only times I've seen that, it's gotten worse, like when they exercise. But for me, it improves. But other people with internal jugular vein compression, I have met that it also improves from them. Like the only one, like. But I asked in a survey, and I think about 10 people answered it, and I think 2 people said it helped them, and the rest said it makes it worse. Nobody said it did nothing. So everyone who has tinnitus and has internal jugular vein problems and bothered to take the survey, it's only 10 people, but that's what they said. There was nobody that said no effect. Whereas if I ask on the tinnitus group on Facebook, I don't know, probably like 85%, 90% of the people said it had no effect, the exercise. Maybe made them feel better, but it didn't actually lower the volume. But for people in the venous outflow group, there was a significant amount of people that said that it's affected. I mean, they all said, all the people that responded said it affected it. So, although there's a lot less people that responded. So I've been went up to Gainesville to talk to a neurologist or neurovascular doctor, and so they want me to do like a spinal tap, like lumbar puncture, to evaluate pressure, and I think there's this medicine called dioxin. Or I might be wrong on about that, but it's something they give you so your brain produces less whatever fluid, brain stuff, I don't know, that needs to drain, because that part of that goes down through your veins. I think the main problem is the blood. I'd say that's the main issue, but they said there's not really much you can do to help with the blood flow. Although when I take Advil, tinnitus gets a little quieter, so that helps some. But it's kind of diminishing returns. Like if I take Advil like once or twice in a week, I'll have a noticeable effect. But if I take it every day, it stops having an effect, which seems to also correspond with what happens to everyone when they take Advil for anything, even if it's not tinnitus related. If it's, you know, your shoulder pain or whatever, if you just take it every day, then it starts to lose its effect. I don't know why that happens. I don't know if the body's saying, you know what, you're not supposed to be this way, like your blood's not supposed to be this way, so I'm gonna make more or counteract it or whatever. I have no idea about that, so just know that it happens. So if you're gonna take Advil for something, it should just be short term. Any kind of NSAID should be short term, shouldn't be long term, because long term it loses its ability to help, and it can even cause problems and cause more inflammation. So I got that going on. And then so they also referred me over to the surgeon, because the neurosurgeon, because there's surgical options. Like I'm still waiting to hear back from their office, because it's just earlier this week. The neurosurgeon has to call me and schedule an appointment, and thankfully I can do that remotely. I don't have to drive 3.5 hours. But they could do something like, they could look at possible styloid removal. I don't think, for me, the styloid doesn't seem to be much of a problem. Mine's not overly long. Some people have some exceptionally long styloids. Mine's just like 2 centimeters, 2.5 centimeters, pretty normal, maybe slightly longer than normal. But when you see the image of the CT angiogram, which I rendered in 3D using Radiant, if you see that, then, just a sec. But if you see that, then, saw something back there. If you see that, then it's obvious, like, that it looks like someone's taken a garden hose and just bent it around their knee. My knee being the transverse process, the C1. So it's like if I took the like a garden hose and wrapped it around my knee and put a big kink in it, and then you touched it, your hand being like the styloid process, like you just take your hand and touch the hose, like, which thing is the problem? It's not your hand. It's me grabbing the hose and wrapping it around my knee. So that's kind of what's going on with the jugular vein here. So in that instance, you could shave down, you can make a groove in the transverse process without, say, like damaging the ligaments that connect to it, or hopefully not injuring the artery that runs through your transverse process. I forget which artery that is, but there's only one. So, hey, how's it going?
Hey, how are you?
So that's an option, but then, finding a doctor that is aware of that procedure or has any experience with it, like any reasonable amount. I mean, that's pretty major when you're working on cervical vertebrae. Like if it was like, my thoracic or lumbar spine and just wanted to shave a little down, I'd be like, whatever, it's not the end of the world. But your C1's your most important vertebrae, I suppose, and it's the one you want to injure the least. And so that's kind of intimidating to think about. So I have to figure that out. And I don't think there's like, you can do stenting, but I don't know if that would even work. Like the C1 transverse process, like pushing on it, I've talked to a lot of people on Facebook, and they say, well, that doesn't really help. So, like, because it's still being squashed. So I don't know if getting a stent would be a thing to do. I don't know. So, but that's where I'm at, and I'm trying to figure out, what do I do to get the blood flowing again, because it's not. I'm looking at the Dr. Centeno. I'm doing another digital motion X-ray in Tampa, and then next week, and then I'm gonna talk to Dr. Centeno in Colorado about doing PICL therapy, and that's where they inject stem cells into the front of they go through the front of my C1 through my mouth, and then, because it's like your C1's like straight back through your mouth basically, and they go through the back of your throat, and there's 2 holes in your C1, and then they inject stem cells that way. And that's an expensive procedure because it's new. They're the only people that do it, so they can charge out the ass. But if you, I mean, I guess it's reasonable. I mean, these guys spend a long time training, and it's not just them. They have to pay an office staff. They have there's anesthesiologists that have to, put me to sleep. And, but I imagine if there was some competition, the procedure might go down to, $5,000 or something like that. If it was more, plus once it was more streamlined, more well established, there were more people that were trained how to do it, it became more routine, then it would probably become somewhat cheaper. And it'd be nice if it was covered by insurance. But That's not the case currently, so we were looking at between $10,000 and like $13,000 a treatment. Probably need a couple treatments, so that's the thing. And I tried to get solid data on whether or not that would even pull the C1 back, because if you repaired the ligaments and the C1 backed off the internal jugular veins like half a centimeter, that'd be enough to probably completely, nullify the problem. There wouldn't be an issue with that anymore, and my neck would be strong. Like, because even if I deal with the internal jugular vein issues, I still have a neck problem. So my neck feels stronger for sure. Another thing I changed is I stopped going to the upper cervical chiropractor. I was going every week, and my neck always hurt, and it was weak. And even when I was doing prolotherapy and PRP, I'd go back to the chiropractor and get another adjustment. And they're gentle at the atlas orthogonal, but they are moving, they're pushing on the vertebrae with the damaged ligament. So you can be as gentle as you want, but that's what you're still doing. So I don't think he did anything wrong, but I think he was hurting me every time I get adjusted. And there's definitely limits. Like, if you said to an atlas orthogonal chiropractor, like, hey, well, would it be bad if you adjusted someone every day? And they would say, yeah. Like, you don't want to do that because you'd hurt them. So it's not like, it's just, there's no consequence to getting adjusted. There is, for sure. It's just where that varies from person to person. And for me, once a week is too much, apparently. Some people are okay. Like, if you've got like 2 to 3 degree rotation, you're probably not that bad. But I started out at like 18 degrees, which is like, you were in major damage territory. If you're like above 5 degrees, I'd say you need to get a digital motion x-ray. You just need one. And you need to see if there's ligament damage. And they probably will find some ligament damage. And then in that case, you could go get like posterior injections. Like I go to Picl and Kissimmee and get PRP and prolotherapy, and that helps. Like, I was having some bad tinnitus after I got adjusted, so I went and got some more prolotherapy because I felt like he had undone all the progress I'd made with the prolotherapy, because my neck was hurting again, tinnitus was blaring, I wanted to die, it was awful. And so I got prolotherapy, and that day the tinnitus was quieter, and the next day, and since then it's been quieter. It's been like 2 weeks, 3 weeks almost. Even though I thought it was just because the stiffness and all, because you get swollen immediately when you do within a few minutes, I guess, you start to swell up. That's the purpose of prolotherapy. Causes inflammation and initiates healing process. And so I had that done, and then tinnitus quieted down, and then I was like, but the reason it got louder was like the Friday before I got that done on Monday of, like, not last week, but when I got it done, it was a Monday, but Friday before that Monday, I was at the chiropractor and he adjusted me, and the tinnitus had gotten a lot worse. And then I was like, oh shit, like, what happened? I was like, well, it had to be him, because that was the only thing I did differently, was that. I mean, not that I never do that, but that's the only thing that I did. Like, I took it easy all day. I wasn't working out hard with my upper body or anything. That was it. That was the only thing that had anything to do with my neck. So I was like, I'm gonna stop going to the chiropractor for now, maybe for a long time, I don't know, and see how it goes. I still might go back to him in the near future, just to have him do some x-rays to see like how the alignment is, because I want to see like if the prolotherapy is helping. Like, maybe the rotation will improve on its own, because the ligaments are getting stronger. But I don't know, I feel pretty strong. My neck and the tinnitus just hasn't been as bad. I noticed too, when I've been getting up from bed, tinnitus has gotten quieter, faster. Usually it takes like an hour or two. Like, if I just get up and don't, like now I'm going for a walk, but if I just get up and like just hang out, sit at my computer, whatever, it'll be several hours before it starts to quiet down and gets a little more manageable. I still have to I had to have like constant background noise on, but like say I'll go to the bathroom or something where it's quiet and then you can hear it. And yeah, it takes a few hours. So I'll go for a walk. But I noticed that even without doing that, I'd seen some improvement there, so that was nice. Even if, I don't know how long that'll last, where it gets quieter faster than it normally does, but I'm not complaining. So yeah, prolotherapy has helped. I'll probably go back. I'd like to go back Monday again to get some more. I mean, if it's helping, as long as it keeps helping, I should keep doing it. If things keep improving, and then if they stop improving, then I should stop. But it helped a lot, and not going to the chiropractor helped. So I'm gonna keep doing that. Yes, I think that's everything that's going on with me. I should probably make more regular videos, not sitting here wondering like if I've talked about everything, but yeah, that's the general idea, what's going on with me. So I guess the CT angiogram was funny, or it was, say funny, but it's pretty fucked up. Like I went to originally get my internal jugular veins checked at my doctor, the vein doctor, vascular doctor. First I got checked and they're like, there's nothing wrong, and I said, did you check? Fine. 2 weeks later I'm reading about it online and everyone's talking about like, well, with the C1 injury you got to worry about your internal jugular veins, because those are the things, right? They're right there. If your C1 moves around, it's squashing them. Pretty much gonna happen. So I asked him, and this all started because I was like, well, my blood flow increases tinnitus goes away. Clearly it's a blood flow problem, or at least pretty sure. I was never 100% sure, but I was like, well, it makes sense. So anyway, I got checked out, and then he said it's no problem. Then I said, did you check my internal jugular veins? He said no. So I said, can you? And they said, we don't typically do that. I said, well, can you? And then they said we can't. So I'm like, okay. So I start calling other places all over Florida and all that. But then they call me back the next couple of days and they say, yeah, we can do that. So then I'm like, okay, you can do that. Let's go do that. And I get tested out, and the technicians, they're looking at me horrified because they put the ultrasound on my arteries first. And then they're just making all kinds of like whooshing sounds. Like, if you want to hear what an ultrasound sounds like on arteries, I'm sure there's a lot of YouTube videos. Just making all kinds of those sounds. And then they got to my internal jugular vein, and it was barely making any sound at all. It was very quiet. I mean, I know they're further back, harder to get to, but it was practically nothing. And she looked horrified, like the technician that was doing that on me. And she said, we're not allowed to tell you, like, we're not allowed to interpret the results for you, because that's what the doctor is supposed to do. I don't know if that's a legal thing or just what their practice does, but so anyway, she looked horrified, and I was like, okay, good. I mean, it's not good, but she found something, which what I had been suspecting. And so then a week later, the doctor's like, yeah, you're fine, you don't have any problems. And so I'm like, God damn it. Like, and then he said, like, I was pretty sure he was full of shit, but then I was also like, what if I don't? Like, what if that's not it? And then I was really demoralized, obviously, because I'm already like suicidally depressed. And I'm hearing like, well, you still don't know what the problem is. So yeah, I was pretty pissed off and depressed. And so then I'm like, well, I'm pretty sure there's got to be something going on in my vein. So I want to actually see for sure, because I want to see it. So I wanted to get like a CT angiogram. So then I call a hospital not I don't call it hospital. I ask them for one. They refer me to the hospital and say, here's your, yeah, you can get a head venogram. But I'm like, well, if I have a C1 issue, and the head starts at the C1 and the neck ends at the C1, so they're both kind of catching like the tail end of the problem, like the edge of the scan is going to catch the problem. I'm like, I need the center of the scan to catch the problem. Like, your internal jugular vein runs from the top of your head down to the bottom of your neck, right? So I'm like, I want to get the whole thing, and then see other stuff too if there's other stuff going on. So I'm like asking, like, can I get a head and neck? Because I actually do need to see the problem. And insurance is like, no, you don't. You have tinnitus. You don't need to see the head and neck. You just need to see the head. So the insurance in this country, at least in Florida, they're unaware that tinnitus can be caused by something below your top of your mouth, which is weird because, like, the C1 is here and your ear is here, so you're talking about like half an inch higher than your mouth, you know. So it's like, that's where the ear starts. So it's kind of like it's where the problem. I mean, the ear's in the middle of your head. It's not in your brain. And I don't know exactly what's causing tinnitus, like the blood flow touching the bone, which conducts it to the ear, or there's outflow veins from that are, you know, being used more because there's other routes for blood to go. Otherwise, you know, my head would pop. Like, artery blood would go up in my head and it wouldn't come back down, and I would just die. So there's other ways for the blood to get out, but it's not good. Like, that doesn't mean you're okay. Like, I met a lot of people with blocked internal jugular veins where it's problematic. It's, you know, partially blocked, like even not even 100%, just like it's partially blocked, maybe like 70% or something, and they've got major problems, and then they get rid of that blockage, and then, oh, no more problem, including tinnitus. I've had that like complete resolution in people where it's just gone. So anyhow, I don't know what exactly is causing tinnitus, but I know that, like, it's sort of in the middle of your head, in my case at least, and I need to see that. So they said no, and I said, okay, well, I definitely need it, and I don't. And then I was thinking, like, well, my copay is $250. And I talked to Dr. Middleton in Fort Lauderdale. He's a chiropractor, and I've been seeing chiropractors, so it's like I get, they understand when I'm saying, like, I have a C1 problem, and he also understands C1 problems can, like I saw a YouTube video, he understands C1 problems can cause issues with your internal jugular vein, which most doctors are not aware of. So, I mean, if you ask the doctor, like, could a C1 problem cause a problem with your internal jugular vein, they'd probably say, maybe, if the structures are right next to each other. Like, I don't see why not. But it's not something they're really familiar with. So, anyway, but he is, and I've already been seeing the chiropractor for a while, so I know what's going on with my C1 for sure, and he understands that as well. Like, I just say, like, hey, my C1's rotated, and, like, I suspect internal jugular flow problems because of the tinnitus, because of the brain fog. It started at the same time as the neck injury, and he frequently sees people. That's what he does all the time. Like, every week he's working on people with internal jugular vein problems, and there's only so much he can do. Like, he can try and correct the C1, but at least he's aware of it. So he wrote me an order to go get a scan, and he got a lot of data on it on this disc. I don't know if it was the most detailed scan ever. Like, there's more detailed equipment than he had me do at Body Scans, where I got it done in Fort Lauderdale. But it's good enough. It was not a poor quality CT. It was good. And I converted it to 3D with Radiant, which I thought would be hard. But it's just, you just open the folder, you tell what folder to look in, and you have your different views of, like, you know, because he had a few where my head was turned in the CT. And then there's some where they said, here's your venous view, here's the arteries view, and I'm like, I don't care about the arteries so much, so they're good. I mean, I looked just to see if they're good, and the radiologist did too, and he didn't find anything. But with the veins, the radiologist he was the one that said 90% stenosis in the right internal jugular vein, and then and 80% in the left. And then so I go in and I click on the image to bring it up, this series of slices that you can like zoom in and out and see the different layers and all that stuff. But I open that up in Radiant. There's a button that says 3D. Click 3D, and it turns it 3D. So now you can zoom in and out, you can pan the camera, you can rotate it, so you can just basically fly around in 3D and look at whatever part of whatever you want. You can remove layers, you can add more of tissue or remove tissue, so you're mostly looking at the bone, and not even any veins if you want. But so I convert to 3D, and it's like you can see like what I was saying, where it's like wrapped around transverse process. It's really tight on the right side. And left, there's definitely narrowing there, but then my tinnitus isn't that bad on the left. It's mostly right. It's an issue, and yeah, so that's what I did there. So that I was at oh no, but then I found out later. I'm going on to my chart thing because I never really signed on to that. And I talked when I was doing the insurance fighting thing with like the vascular doctor, because I'm like, I really need head and neck, and they were denying me and all this. They said that they would. Oh no, I got the report. I had to have body scans send my vascular doctor the report so that they could upload it to my chart so that I could see it, because they wouldn't just send it to me. Because they're like, we can't send this to you because in Florida we send results to people and they freak out and lose their shit. So there's like a law, you can't do that anymore. You can't just send results to people. You have to wait a certain amount of time. Give the doctor a chance to talk with the people about it and say like, you have this going on, and now the person's not freaking out. Because it does happen. I mean, I'm not saying don't look at your scans and make up your own damn mind. Just keep in mind that you try to keep a cool head about it if it's something really serious. But like, and also understand you don't really know as much as a radiologist. That being said, every radiologist I've seen, except for the one that told me what problems I had, has been wrong. So that's like 5. Like I've personally done better than 5 radiologists, and I don't know shit. So if anyone's like, don't look at your scans, like I'm the authority figure, tell them to go suck a dick, because that is what they should do. And even if they enjoy it, it should be used as an insult. Or whatever they don't enjoy, that's what they should go suck on. And so anyway, so I got, oh God, why did I go inside? It's, quieter in here, noisier tinnitus. Anyway, so I get back, and I go and do the my chart thing, because I'm like, I want to see my radiology thing that said whether or not, and I'm freaking out too, because I'm like, holy shit, like this thing's going to tell me whether or not I have a problem. Nobody would say on the phone or anything that there was any problem found. So I'm just like, if it doesn't fucking show it, like, I don't know what the hell I'm going to do, because I'm having a really hard time, right? Like, probably some people seeing this, like, you're just like, what the shit? Like, how am I supposed to deal with this shit? And I deal with a lot. Like, I'm the kind of guy that like goes out and exercises for an hour every day before all this. So anyway, I check my chart, and they're like, yeah, 90%, 80%, 90% right, 80% left. But then there's another paper that was uploaded from the original tech that did the internal jugular vein compression check on me. She was the one that looked mortified, and like was like, I don't know if we're gonna have to send you to the hospital or what. And that said that they did find the internal jugular flow problem. There was limited blood flow in both internal jugular veins, and they recommended I get a CT to check, to evaluate that with contrast. So that's what they said that I need. And the vascular doctor said I have nothing wrong. Meanwhile, I'm walking around with greater than 90% stenosis in the right and greater than 80% in the left. And it's like, what the fuck? Like, how can you be so grossly incompetent? Like, They said you have limited blood flow. If a technician checks your internal jugular veins, your arteries, or anything, and maybe this is like some prejudice against veins, like, oh, veins don't matter, whatever. But still, if I'm a doctor and someone's like, your veins compressed greater than 90%, I would, even if I thought, I don't think it's causing their symptoms, I'd say, that's pretty fucking bad. So why don't we just check it out? Everyone's like, so like, oh, but the radiation though. I'm like, so I can have one CT in a year. Like, big whoop. Like, who gives a shit? Like, fucking Christ, man. Like, the symptoms are so severe. I mean, greater than 90%. You think you would just say, all right, well, let's check. Because if they had done that, then I could have got the head and neck. But it didn't really matter because, it's $350 through Dr. Middleton, $250 through my copay insurance. And I got exactly what I wanted and needed through Dr. Middleton. And I recommend anybody should call him. He's in Lord's Chiropractic. Not religious. He is. But whatever. He understands the problem. And he's not wrong about any of it. Curve correction he talks about how the C1 can compress things. He can try to adjust you to fix that. He can suggest exercises to fix that. The curve correction is like some weight thing you wear in front of your neck like 15 minutes a day. If you ask him about that, he can talk to you about that too. I think it was like $300 for a remote consultation, $350 for... I didn't really need him to explain the results to me. I just needed the angiogram because it's pretty straightforward. The radiologist says, here's what the problem is. I'm like, yep. And Dr. Middleton would explain how your anatomy is causing the problem, but I already know that because I already know I have the C1 problem. And obviously when it's 3D, it's... But I paid him anyway just to, say thanks and just in case there was anything I missed. But so in all, it's $650 out of pocket. And but I have proof, and now I'm trying to figure that out. I'm trying to figure it out. Kind of know what to do. The regenerative therapy, I have to fix the ligaments in my neck, and then whatever kind of surgery, I'm kind of on the fence because I'm like, maybe I should just try the PICL first and see if that resolves the issue. But then I'm talking to people, and they're like, yeah, it's helped with the C1 rotation and the strength of their neck and all that stuff, but there's no one that's been like, oh yeah, you're like just totally cured and back to normal. Like, everyone's seen great improvement that every other doctor on the planet would have not been possible to do. Like, nobody. So Dr. Centeno and Dr. Schultz, the only two people on the planet that can even do this. Like, the whole planet. Not in China. Nowhere. At least if China's doing it, they're not releasing a publication on it, which they probably would. I assume. They release a lot of medical stuff, but if they could do it, they would be a lot of a foreign investment. They'd make a lot of money from people flying in to get the procedure done, because it would probably be done cheaper in China. So people would say, okay, I'll fly there and do it for $5,000. Or, if you pay 10,000 USD in China, that goes a lot further. So even if it's the same price, you got to wait months to get it done in Centeno Schultz. Whereas, if they did it a little cheaper, I'd fly to China. I would fly there. Literally, I'd just go there and get it done there. So I don't see... Anyway, just besides the point. So if they fix the ligaments in your neck, in my neck, that might correct the atlas some. Now, to say, is that possible at all? I have talked with people where they've seen some improvement for sure. Like, they'll be someone was at 7 degrees, they get PICL, and then they're at 0 degrees. So, it corrected. But I don't have, the data set of, 1,000 people and, how often that happens or anything like that. I've been trying to talk to Dr. Centeno about that. I'm not sure that's something he even tracks, because he would have to coordinate with upper cervical and other people, and that's a lot of time and effort, and not a lot of time and effort actually. Minutes. Minutes for him. So I would have to go to the upper cervical chiropractor, 2 weeks out, 4 weeks out, and get x-rays, and then send them back to Dr. Centeno and just say, I am now at this degrees, and then he would just make a note. So for him, not much work, but you'd have to have the patients do that and pay for it. So that would be very useful to know, though, because that's one of the main reasons why people even, like, that's one of the main symptoms that people have, not symptoms, but structural issues, like you how your C1's rotated because you have ligament damage in your neck and your C1, maybe C2, and then so your C1 is all kinds of moved around, and people usually figure that out before they have ligament damage, and so that it'd be nice if you can know stats on that. But I did have I was kind of stuck at about 10 degrees for like 6 months, like since I got here. It's like April or late like May last year, and like in October, I was still at 10 degrees, and I barely made any progress through December. I might have been at like 9, so it was pretty much the same. But then I started doing prolotherapy and PRP, and then I was still doing Atlas orthogonal too. Like once a week, I'd go to Dr. Kleiman and in Port St. Lucie, and um, I got down to about 5 degrees, and I had a noticeable improvement. Like as the C1 gets more back to where it should be, my tinnitus has improved. So anytime I've seen noticeable improvements in the C1 rotation, I have had improvement in the tinnitus, which I guess makes sense because it's probably compressing the veins less. It might be pushing on nerves less too. But there's another thing I wanted to note too, is that I believe pretty strongly that if you have your C1 pushing on nerves, it makes a solid just e like sound. That's a nerve. And I even had someone put a TENS unit on my back, and this wasn't intentional, but it was near my spine. It wasn't even that far up. It was like, I don't know, whatever like the 10th vertebrae down is. And they turned it on, and I got tinnitus immediately. So they were hitting the nerve, and I got tinnitus, and it was just a solid E sound. It's just E, just a high pitch, but that's what it was. And there's sometimes when I'm leaning forward, like if I hunch over at the computer, right, I'm just like this, doing whatever, like poor posture, I'll get that sound too. Just a solid E sound, which I believe is the neck kind of moving a bit and squashing against, I don't know, brainstem nerves, whatever, what have you. So I think that if you're experiencing that after a neck injury, then that's what you got going on. But if you've got like humming and ringing and whooshing and hissing and all these kinds of sounds that vary all sorts of crazy and change when you exercise, that's not your nerve. That's blood flow or something like that. So just to give you an idea, like what you're dealing with, if you have a solid E sound, then you're probably dealing with the nerve. It doesn't mean it can't be the spine at all. It could totally be your spine because mine does cause that. But if you're dealing with blood flow and you're hearing all kinds of wacky sounds, I mean, if you're hearing all kinds of wacky sounds, it's probably not a nerve. Um, that being said, um, I'm not saying there's never an exception to that. Like maybe you got blown up in a war and your nerves are all kinds of messed up and now you hear all kinds of crazy sounds. Maybe it has nothing to do with blood flow. But just in my own experience, anytime I hear an E sound, that's nerve. And it's probably in a lot of other people's too. So that's just something to keep in mind. I know a lot of people I've talked with hearing damage, like they're shooting a gun without hearing protection, they just get this solid E sound. They're not having like a bunch of wacky sounds, and both ears being different too is another thing. And then also I have no hearing loss at all. Like I take hearing tests and it's like better than perfect. Not that much better. I don't have like super sensitive hearing, but it's just like I'm scoring above average, above average for normal hearing. For people with no problems, I'm better than that. So anyway, yeah, that's if you've got no hearing damage at all, and you're looking and you're seeing your C1's a little wonky, and you're hearing all sorts of wacky sounds, I'd say you probably need a CT angiogram, because that's, I mean, especially with people with forward head posture, having your neck just be straighter can narrow the gap between your styloid and transverse process. I had my curve checked. It's not really that bad. It's okay. I'm still going to look into curve correction and see if that can help a little bit, but there's not much to correct for me. But if you see my CT angiogram, you see like, normal curve, normal curve, normal curve, and then the C1 is like, blah, just like pushing dramatically on the internal jugular veins, and it's like, it's not neck curve for me. I'm not saying I don't want better neck curve, but it might help some. Might pull it off, pull it back a bit. So yeah, I know this is probably not the most interesting monologue here, but I just needed to get this out there because eventually I'm just going to forget, and there's a lot of important stuff I've learned. And I'd also say, if you're having issues and you want to ask questions, like, you can go to the Venous Outflow group in Facebook. You can go to PICL CCJ, standing for, I forget what PICL stands for, but CCJ is craniocervical junction. And then, so PICL CCJ instability group, that's another good one. And then there's also like prolotherapy PRP group you can join. So it's like people like me who've done a lot of research because they're suffering and they know a lot of stuff. And sometimes I'm wrong, sometimes they're wrong. But if you ask on these Facebook forums, then it's like, you have people who've been dealing with this a long time. Even if they don't know, you can get a consensus. Like, 2 people might say one thing, but then 20 people say, no, it's this other thing for sure. And you're like, oh, okay. Versus just talking to one person and maybe talking to getting the wrong info. Like, so that's good. Yeah, I think that's it. If you have any questions, feel free to ask, and I'll try to answer best I can. And of course, if I figure out what to do about stuff, of course I would post it. I mean, if I was cured tomorrow, I would definitely tell everyone. But usually I've been waiting because I'm like, I don't want to say, like, like constantly say, maybe it's this, maybe it's that, maybe it's this, maybe it's that, because that's what I do every day. And why not just wait until I figure something out? So I figured stuff out to a point, so I'm posting that. And when I figure more stuff out, for sure, like if I get surgery and it helps, for sure, or I get PICL and it helps, and whatever, I'll let people know. So yeah, I'll see you all around.